A PNP is a pediatric nurse practitioner.
We can diagnose, treat, prescribe, just like a doctor would, but with the touch of a nurse.
Kids A to C with the PNPs. I is for immunizations.
Hi everyone, welcome to Kids A to Z with the PNPs.
Where each week we take a closer look at some of the common health issues affecting our kids.
We're your hosts, I'm Cortney.
And I'm Dominique.
And today we're going to talk about the letter I, and I is for
immunizations.
So we're going to be talking about immunizations or vaccines. We'll use those terms interchangeably. So what is an immunization? And a vaccine is a substance that we give to our children on a special schedule that helps prevent them from getting some pretty serious diseases.
Vaccines protect us from diseases like chickenpox, the flu virus, whooping cough, meningitis, measles, mumps.
Yeah, rubella. And a lot of these diseases can have lifelong, if not fatal, complications. So it's an important topic to talk about. Basically, the idea of immunizations is to kind of trick your body into thinking it's already had the disease, so that if your body comes in contact with it, you don't get sick.
So there are some circumstances where kids can't receive certain vaccines, or the kids are too young to be fully immunized. These are your children that have maybe a weakened immune system due to the medications that they're taking, or conditions that they have, like kids receiving chemotherapy with cancer or immunosuppressants with autoimmune disease. Or some kids are just too young, or we don't start vaccinating until 2 months, so the younger the baby, the more susceptible they are to getting some of these diseases before they're vaccinated.
So I think we should take a minute to talk about herd immunity, which you may have heard about. So when you think of a herd, you think of like a group of animals, right? But herd immunity basically refers to our community and us as human beings, and how we can protect one another, especially the most vulnerable of us, our young children and our kids or people with weakened immune systems in general.
In regards to herd immunity, I think it's also important to know that not only should we be vaccinating our children, but also receiving our boosters and immunizations that we need as adults too.
So we're going to take a minute to talk about a few myths that you may have heard regarding vaccines.
The first myth is that vaccines cause autism. There was actually published research that has since been retracted and was actually found to be falsified that linked autism to the MMR vaccine. There has been more recent and larger studies that have found no correlation between the MMR vaccine causing autism.
Yeah, and I think the reason for a lot of this talk, if you think about when your child, a lot of development takes place around like 12 months of age, which is when you're supposed to receive your first dose of MMR, measles, mumps, rubella vaccine. And so I think this is the period of time where a lot of parents are noticing, hey, my child isn't developing normally. My child isn't talking like they should. They don't have the motor skills, where parents are starting to notice like, hey, something's not right with my child, and that they might be finding early signs of autism. So just because those things happen at the same time doesn't necessarily mean that one is caused by another.
Another myth that we hear often is, I got the flu vaccine and then I got the flu. So not always the case. A lot of times we're giving the flu vaccine during flu season, and also a lot of other viruses are going around. So I think it's important to note too what the flu is.
Influenza.
The influenza, which is different from the stomach flu or the stomach bug. It's actually a respiratory virus that can cause trouble breathing, coughing, very high fevers. So typically, the people that say they got sick after the flu vaccine may have just picked up another virus that's going around. And also a side effect of the vaccine is sometimes not feeling well. That's likely not the flu virus.
Yeah. Also, when we get our flu shots, we tend to get them at the doctor's office, which is where sick people go. So people get their flu shot and then a couple days later they develop these symptoms. It's very likely that they picked up something while at the doctor's office, or something that was just floating around because of the time of year it is.
So now we'll talk about some side effects of vaccines. Usually vaccine side effects are mild. They can include anything from pain or swelling at the injection site, overall feeling just tired, sometimes developing a lower grade fever and body aches, overall just not feeling good, and rash.
And most of these side effects are mild and they resolve in a couple of days. If your child is experiencing some discomfort after receiving their immunizations, you can give them a dose of Tylenol, or if they're 6 months of age or older, you can give them a dose of Motrin just to help keep them comfortable in the couple of days following their shots.
Vaccines are generally given at the pediatrician's office with your child's well-child visit. If you have any concerns about being able to afford vaccines or having access to health care to get your child immunized, there is a government-funded program called Vaccines for Children. And if you have questions about this program, you can talk to your pediatrician or go to your local health department. Your child may qualify to receive vaccines free of cost. So if this is ever a concern of yours paying for the vaccines, talk to your pediatrician or go to your local health department.
I will say that in my practice, I get a lot of questions about vaccines, and I feel like it's been happening more and more frequently lately. And my answer to parents when they ask, should they immunize their child? My answer is yes, overwhelmingly yes.
I found this quote on the CDC website that I think fits well in this scenario. We always choose to buckle our kids in the car or put them in their car seats, even though we don't expect to get in an accident. So why wouldn't we choose to protect our kids against preventable and serious diseases?
Yeah, I think that's a great take-home point. So we're going to wrap up this talk, and next week we are going to be talking about the letter J. And J is actually for journey, and I am going to talk a little bit about my journey through postpartum depression and anxiety. So if you have any questions, comments, concerns about what we talked about today,
you can always give us an email at kidsa2z@dmc.org. Comment on this post, share, like, let us know what you're thinking.
Great. See you guys next time.
Thanks for watching.